Secretos con los maestros. Dr. Luiz Carlos Ishida.
Hoy tenemos al doctor Luiz Carlos Ishida. Es un verdadero honor tenerlo en nuestro curso. Es una de las personas que ha impulsado el conocimiento de la cirugía de nariz en el área de la rinoplastia de preservación y de la obtención de resultados naturales. Y le vamos a hacer una pequeña entrevista para que nos cuente un poco cómo es el abordaje que él tiene acerca de la cirugía de nariz y cómo organiza en la cabeza los conceptos para conseguir un buen resultado. Dr. Ishida, nice to see you.
Mucho
Welcome.
gusto. Thank you very much for having me here in this marvelous meeting.
Have you enjoyed the meeting so far?
Yes, fantastic.
Okay, I'm glad to hear that. So, Luiz Carlos, tell us a little bit, who are you? Where do you work? And what is your experience in the area of nose surgery?
Okay, I've been doing rhinoplasty for all my life. My father is a plastic surgeon and he was the chief of rhinoplasty at the University of São Paulo. So actually, I was born looking at this pre and post operatives of patients. And I remember when I was very small, I was looking at these pictures and my father took me to see some patients of him.
Wow.
It was very interesting. And since then, I'm hooked on rhinoplasty since early age.
So that's why some people have all their life working in the preparation for nose surgery, and you are exactly the person who can talk good about that. So how do you evolve the concept of the preservation surgery?
Oh, that's very interesting question. We were looking on the bad results we were receiving from other surgeons. And they were very good surgeons, not bad surgeons. And when you open the surgeries, they were very well performed. Even though everything was correct inside, the result was not quite what we would expect. So back in the 1990s, my father began to think about how to not damage the structures. Because cartilage has a trick. It never bonds itself, never heals. When you cut a cartilage, it's forever. Not like bone, skin, tendons, muscles. And so based on this, we tried to always preserve, not cut any cartilage on the nose. It was a lot of trial and a lot of mistakes that we need to correct. But after a while, we think we got it. And now all the world knows our work and everybody is thinking about preservation. They need to do, of course, but at least you need to think and know preservation of rhinoplasty.
Okay. In this world that is changing every year, you discover new techniques and new ways to change the shape of the nose. What do you think is the main advantage of the preservation?
The main advantage of preservation of rhinoplasty is that when you have to come back and do a tune-up, a small retouch, or anything like this, it's very easy, very fast, like 10-minute surgery. Unlike when you do structural rhinoplasty. I do structural rhinoplasty. I love very much structural rhinoplasty. But when you do a revision in structural rhinoplasty, it's a 2-hour, 3-hour revision. And on the other hand, when you do preservation and you need to do a revision on a preservation of rhinoplasty, it's about 10-minute surgery. I think it's the greatest advantage.
Okay, so you told me that you do a structural and preservation. So
Yes.
what is the percentage that you use in each one of these techniques? And if you combine these techniques in order to do something like we call the preservation and structural surgery.
A hybrid. Oh,
Hybrid?
Thank you for the question. I do 100% preservation on primary cases, and I do almost 99% of structured on secondary patients. Secondary, not mine secondary, of course. My secondary from preservation is 10 minutes, so it's also preservation.
Okay.
Of course, I believe we must master the two techniques, because sometimes you need to use preservation concepts on structural rhinoplasty and structured concept on preservation rhinoplasty also.
Overall, since you start to do preservation in your nose surgeries, what is the overall rate of revision of your own cases when you do preservation?
good question.
And what is the main reason for these revisions?
Okay, good question. Actually, we can divide this on adult patients. We have a revision rate of 3 to 5%. If we analyze only teenagers, like girls between 15 to 18 or boys early 20s, we get a revision a little bit higher, 5 to 7%.
And what is the main reason for this kind of revisions?
Yes, good. Forgot this. The main reason is hump recurrence. Still, we have some hump recurrence and asymmetries.
In the tip or in the dorsum or?
Both.
What is the difference when you are doing these revisions, surgeries, or of your own surgeries? What is the difference when you do the revision in one patient that you have done the preservation surgery with a recurrence of the hump and the structural surgery with a hump that you?
Yes, there's a lot of difference. For example, if I have a hump recurrence on preservation that I did, you just need to go back most of the times under local anesthesia. You just redo the surgery and it will be okay. Mainly it's because too much swelling on the early post-operative period, or you forgot some blocking points that you didn't realize during the surgery. When I need to do a revision, the same aspect on a patient that I did the structural rhinoplasty, I myself did, I always tell the patient that I might have to use costal cartilage again, because when you do the revision and take off the cartilage that are already used, sometimes they're not usable anymore. So I have had cases that I had to have the cartilages taken again to do a revision on my own case that I did a structural rhinoplasty on a secondary patient, of course, and I need to take the second time the costal cartilage.
There are a lot of surgeons around the world that are trying to get into the preservation or the hybrid nose surgery. What will be the best advice that you can give them in order to start doing that safely?
Oh yes, that's paramount. We live today, we are very lucky because we have good surgeons doing preservation all over the world now. I strongly advise go and visit one of these colleagues and see a couple of surgeries, or even better, ask some of them to help you on the first one or two cases. This will speed up the learning curve immensely.
Okay. And one of the last questions is, what do you think that will be the goal or the new advancements of the nose surgery in the future? What will change and what do we have to improve in order to get better results?
Well, this is my eternal struggle. I'm never content with my results, and I've done 3 cases already of full preservation rhinoplasty. So it's minimal incisions, very tiny incisions, no grafts, no cartilage resections, just stitches, preservation of the ligaments, and the result we obtain by repositioning the cartilages, strengthening or loosening the ligaments. And this not, I believe in the future, this will not hinder the results. Like we will be able to treat a vast amount of different kind of nose deformities with this, and will be very much more stable, very reliable, and very fast with fast recovery. I think this will be the future, but not for now. I think a couple more years.
Okay. Well, we are here with one of the masters of nose surgery in the area of preservation and hybrid rhinoplasty. Muchas gracias por acompañarnos. Este podcast lo vamos a colocar en nuestra página de Face and Nose. y ha sido todo un honor tenerte aquí con nosotros. Muchas gracias.
My honor. Thank you very much.
Thank you very much.
Secretos con los maestros. Dr. Luiz Carlos Ishida.